expertise is something that you grow over time. Expertise is a benchmark that you're trying to achieve, right? So every year you're going to learn a little bit and be more competent in one aspect, and then you also can further develop other aspect later on.
Welcome to the Specialty Café, the podcast that helps you, medical trainees, find your perfect specialty. My name's Wong, and I'm a fourth-year medical student at Queen's University. I'm joined here by Dr. Alice Kam, a physiatrist at the International Congress for Academic Medicine in Halifax. I'm here to chat with Dr. Kam about her field, physiatry, and all of its many, many interests and splendors. Yeah, thank you so much for joining me here today, Dr. Kam. Really happy to chat with you.
Thank you so much for having me.
And for the audience, do you think you'd be able to introduce yourself and talk a little bit about your current career and a few details about that?
Sure. So I'm Dr. Alice Kam. I'm a physiatrist, physical medicine and rehab. My main practice is in Toronto. I'm mainly focusing on neuro rehabilitation, so mainly focusing on brain injury. And in terms of my career path, I've been doing this job for 10 years now. And what really fascinated with this job is really the interaction with patients and the dynamics that it brings on, and to really get to know your patient and knowing how they actually function on a day-to-day basis. I think that's really unique in terms of physiatry. On a side job, I also do quite a bit of medical education research. My really interest and focus is on artificial intelligence, AI. So I actually did a workshop this morning on AI design strategies. That's kind of a nutshell of what I do. And
yeah, thanks so much, Dr. Kam. You got a lot on your plate for sure. A lot of different hats that you wear, like medical education combined with AI on top of being like a staff physiatrist. Yeah, a lot of things. Very, very impressive. Before we get too much into you as a physiatrist and your specific career, do you think we could zoom out just for the listeners as medical trainees to talk about what would you define physiatry as?
So that's a really good point. So physiatry itself is a short form. The longer form is actually physical medicine and rehab. So what physiatry is under, you have like musculoskeletal and also have what I call neurorehabilitation. So under MSK, then you can have like doing really sports medicine type, also pain, chronic pain, acute pain, interventional pain, okay? And some of us I also group like amputation under MSK. And then the other component is the neurological rehabilitation. You'll have brain injury, spinal cord injury, stroke, okay? Now, there's a more newer trend in terms of physiatry beyond these two categories, okay? It's more bridging and kind of more interdisciplinary, for example, cancer rehab and also cardiac rehab. Some of us also like practice like, burns rehab as well.
I see. It kind of reminds me of when I chatted with pediatric heme-onc fellow about how oftentimes like we pair these specialties together, like heme and onc, when really they're kind of two worlds of their own. And yeah, this is the first time I'm realizing that the same goes for physical medicine and rehab or physiatry, where you have those divisions that you're talking about, the physical side of it and the rehab side of it. And so yeah, really interesting to learn about that.
Now you're talking about pediatric. There's some of us really subspecialize in pediatric.
Oh, okay. Another whole world as well. Yeah. And we chatted about this on a previous episode with a physiatrist who's a staff and a physiatry residence, but it's a 5-year residency. Is that right?
Yeah, it's a 5-year residency program, and some of us, they even do subspecialty training, so do a fellowship 1 or 2 years.
I see.
Yeah.
Is it common for people to do fellowships nowadays?
I think depending on where you want to practice, because you want the subspecialty training is going to align with your needs. So I don't want you to feel that you have to do subspecialty training like to actually get a job per se, but more so the subspecialty training is going to enrich your skill set to a career path that you're looking forward to.
I see. That's good. Yeah. It sounds like it's good that the kind of availability of jobs can afford people to like choose what they want to specialize in out of an interest in that field, for sure.
Because like some people, they actually want to do, for example, rural, right? Like, practicing in more rural communities, they actually don't want to get that subspecialties because it's not going to have a great right fit for them.
Right. Yeah.
Or like somebody may want to actually focusing on more like, inpatient rehab. Some may want to focusing on like, palliative care. Like really depending on what your niche is.
Makes sense. And do physiatrists work primarily inpatient or outpatient or both?
So that's a really good question. So when I first started, I kind of started as an inpatient and then subsequently switched to outpatient. So you can definitely do both, okay? And depending on the stage that you are at and how flexibility is in terms of your commitment in terms of clinical care versus commitment to your family versus commitment to other interests that you have. Depending on the stages, you may pick and choose for different things that you want to do. So you can definitely have different combinations. So don't feel like you have to commit yourself to, the entire career of inpatient rehab. You can do a bit of inpatient and then outpatient, and then you can pick and choose whatever you like.
Right. That's good. Yeah. Good that there's some flexibility and you being able to tailor your practice to fit the needs of your life throughout your career. That's good. Remembering back to your residency, and when did you finish your physiatry residency?
So I finished approximately 10 years ago now.
Oh.
So I've been practicing for 10 years.
Yeah. And remembering back to your residency, what was that like, if you can recall, like kind of moving through and becoming a physiatrist?
Yeah. So I think the learning curve every year is steep. Because like every time you're actually learning a new skill set. So physiatry is very different. You don't necessarily get the exposure into the specialty. For example, even you do many years of internal medicine, you won't get exposure to amputation per se. And then when you go into the amputation rotation, it's a few months of rotation. And within these few months, you're supposed to be an expert in amputation. So that learning curve, that become quite a jump because like, it's not something that you used to do. And suddenly, okay, I need to be an expert in amputation at the end of this rotation. And that's the expectation. So some of them, that become quite a bit of learning curve. For example, if you do EMG, then, at the end of your few months of EMG rotation, you're supposed to be mastering it. You're supposed to finish reading a few textbooks yet and knowing them inside out. So those are kind of the rotations tend to be a little bit heavier, but I would say overall it's quite a good mix. So like it's not always heavy. So some of the rotations are a little bit lighter. Then it's a good mix. Then you can take a break and then you do a more intensive rotation.
Yeah. I guess like now that I'm at the end of medical school and I look back on my clerkship, it sounds like in some small way for me, I was experiencing what you experienced, just moving through like the primary specialties of obstetrics and gynecology, internal medicine, pediatrics, and going through them. And by the end, having some level of competence, but then moving to the next and then having the tall order of attaining some level of competence. And for you as a physiatrist, sounds like a tall order for sure. That's at the end of that EMG rotation, you'd be expected to be an expert for sure. Yeah, big ask.
Yeah, no, I think over time, you learn strategies, and I think your colleague also help you to move along as well. So I don't think that, yes, I need to achieve this unsupported. I think actually there's a lot of support in place to helping you out. Again, expertise is something that you grow over time. Expertise is not a benchmark that you're trying to achieve, right? So every year you're going to learn a little bit and be more competent in one aspect. And then you also can further develop other aspect later on.
That's a good way to look at it, as like an evolution of yourself over time as a physician rather than just these like blocks where suddenly you've attained a new level. Yeah, for sure. I do want to get to know a little bit more about what your specific job is like, and maybe also while delving into more of the finer details of physiatry. One of which I was interested in is this, well, the interaction between physiatry and procedures. I think a conception about physiatry is that, I guess in like the popular image of it, is that it's all rehab essentially and no procedures. Whereas in just a short amount of time with us talking, like you've mentioned EMGs, and there's also other procedures that I'm aware of, like that physiatrists can participate in. Do you think you could talk a little bit about that? And also how much of it you practice as well?
Yeah. So, I mean, procedure-based practice, it's getting more popular because people usually like to have a specific goal per se, and that usually become quite like rewarding in many ways. So in physiatry, then some of the common interventional procedures are like, people can do interventional pain, spasticity management, or you can do EMG, nerve conduction studies. So those are common procedures. If you do MSK, for sure you will do joint injections as well. So I wouldn't say that there's no procedure, and it can be quite a good mix depending on like your interest. For myself, I'm more family focused person. I I want to put more time with my kids. I end up not doing in really interventional procedure based practice, because usually interventional procedure based practice I need to go with other people's time. For example, if you're sharing a fluoroscopy suite, then you really need to go with everyone else's schedule, not your schedule. When something doesn't go well, you need to stay behind. I would rather to have my own time because then I can spend more time with family. Yeah. So I think it's completely up to you how you like to tailor your practice, depending on what you think that it fit the most, right? So for me, I actually find that if I don't do that many procedures, I can have better control of my time. I can tell you when I can get out of my clinic and when I can go home. That for me is the most important.
It's good to hear from a staff like yourself that you, after all these years of training and like building your practice, can still have the flexibility to change the scope of it to fit like the needs of your life. I would say, like, as a medical student, that's one of the things that I don't often get to chat to staff about in the hospital, just because it's so far down the line and it's so hazy for me to imagine what my life could be like, and if there's any like plasticity to how I can allow it to fit my life needs. So it's good to hear that you're able to do that with your life and spend more time with your family for sure. And you actually touched on like something else that I wanted to briefly discuss. Physiatry has been described, like from what I've heard from classmates, as like a hidden gem almost. It's quite a small subspecialty among all the different Royal College specialties, but often a hidden gem because you have very interesting work combined with what is purported to be very good work-life balance. Would you find that to be the case with a good work-life balance among you and your colleagues?
Yeah. What physiatry is that it allows you to build your own flexibility within it. Because if you hear what I was saying earlier, you can be, MSK one stream, neuro rehab another stream, and also there's other streams like, that's more multidisciplinary. So even within that, there's like a lot of different mix that you can do. Most of my patients that I end up, spending time with, some you also can develop more longer term relationship. So that's a kind of a really nice balance in terms of how you want to build your practice.
That's really good. That continuity aspect, like the way you chatted about it just now, is like an interesting realization for me, because you're right. I feel like when I envision a subspecialty, like cardiology, for example, in the inpatient environment, oftentimes you're a part of like some small part of a patient's journey, and then that's it. You've solved the AFib, and then that's it. But oftentimes it's because of like that short time that you have with that patient, I guess you don't really think about like the lack of continuity, but it's good to have the continuity in physiatry that they can afford, especially when people are, for example, rehabilitating over many, many years. For sure.
Because I think physiatry also pick up some of the not so common diseases and those some subspecialty niche that require a little bit longer term follow up to build the report, and as well as to build a more therapeutic relationship further down the road.
So we chatted a lot about like the details of like the life of a physiatrist such as yourself. I wanted to delve more into like, I guess, like your daily practice and kind of tease out what really excites you about your job, what keeps you going. Is there like a case that you think you could highlight that highlights aspects of like intellectual challenge and also like those elements of continuity and building relationships with patients that like really gives you love for your job?
So I think what it really give me love about my job is like my job allow me to having the endless possibilities and that also the creativities that brilliant. One of the case that I can think of is recently we are doing a project on compassion. Compassionate care, what compassionate care is. When I hearing from my long-term patients, how they describe their definition of compassion, it's actually quite surprising as well as a learning point for me. Realizing that our medical system is not so perfect. There are many points that we can further improve. I think that's really unique in terms of physiatry. I have the the privilege to be able to go into that kind of depth to gain a new knowledge about what compassionate care is, on top of my bread and butter physiatry work.
What different ways have patients described what compassion means to them?
Yeah. So that's very interesting. So I think one of the really wake up points for me, okay, is people not so much thinking about like, oh, I need to be providing empathy, like, I need to listen to you, okay, you're crying, oh, I'm so sorry, giving you the clinics. As more patients are saying that, you know what, compassion is, turn them to be advocacy, turn them to be an agency. That's what they find that, what compassion care is. They want to be the one that advocating for their own disease. They want to be the one that, being able to communicate with their physician, communicate with the healthcare team, about, their own issues.
I'm hearing the themes of greater independence. Maybe it means like the knowledge to understand one's own disease, like the ways that it could go, ways that they can help themselves. Also, like the power to do something about it as well. Like oftentimes, I'm sure in physiatry, you can be helping patients who have gone through life-changing events and have had like significant losses of function. And so I can imagine that in that like really difficult time for them, what compassionate care could be is to like manage expectations, provide hope, provide options, all things that could give power back to them essentially.
Yeah. So it's a sense of empowerment. And also, sometimes it's good for them to know that they can actually, move on. So one of the really good learning point I learned from my patient is that, you know what, the time that I find this compassion is when people are telling me that, you know what, the problem that I have is permanent. Because they went to many different doctors and they thought that there's a hope for, fixing a problem. And I went to, a compassion doctor and the doctor would be telling me, you know what, this is permanent. So they feel that that's actually very restful. They don't need to keep going to different doctors anymore.
It gives them peace. Yeah. That is a really excellent way to put it. Really powerful words. Yeah. So yeah, we've chatted about a lot of really like deep, meaningful topics about like physiatry and like what it means for patients as well. Just wrapping up like this discussion about physiatry, I wanted to know, are there any like general conceptions of physiatry that maybe like the medical community has that you would challenge or say are maybe less true?
So that's a really good point. Like, is there any myth about physiatry? I think what people always think is like when they select this subspecialty or when they, moving from med school to residency, they want to select the most popular specialty because the most popular specialties are going to be aligned them with everyone else. But I think what you need to realize is like what actually driving your passion, what actually fits you the most. And I tell all my learners, when you select your career, select your specialty, you want to think about which specialty actually fits you, not just fitting you yourself, also the people around you. Like, it's going to fit your family. It's going to fit the expectations of your spouse. And how are you going to meet those needs, right? I think every family or every, learner, they have different needs. And, does that mean you need to do a lot of traveling, a lot of commuting? Is this something that you want to spending the rest of your career in? So those are kind of moments that you want to think about, how you select your specialty, whether that will be, something that it will be a good fit.
Yeah. So sounds like maybe like a conception about like physiatry is that like because it's more of like a secret specialty, like with less people in it, by extension, it might be seen as like not as desirable. Whereas in like we've gone over how like physiatry can offer you so much flexibility with how you can tailor your practice, the types of medicine that you can practice in terms of like acute versus chronic, inpatient versus outpatient. And so all things that like you really should consider if you're a med student hoping to go into a specialty, and like with particular attention to things that matter for your future life and things that will allow you to create the life that you want to create. Yeah. Great advice. Yeah.
No, I think you summarized it really well. Because at the end of the day, we really don't want to make decisions for learners. We want you guys to find your own specialty that you like and you can stick with it. Because we are here to help. We cannot be there for forever for you. So at the end, after a few years of residency, you are going to take your own path and create your own career and create your own niche.
As my last question, and in the general line of advice that you would give to medical trainees, is there anything upon reflecting back on your medical journey from your now staff position that you would have wanted your past self to know as a medical trainee?
Yeah, so I think looking back, is there anything that, I think I could have done differently? I think having an early exposure to different specialties, is really helpful because you can pick out what you like and what you don't like. Doing your rotations, don't hesitate to explore because a lot of time, because the med school is so short, and all of us is like, oh, I have to do this specialty because then I need to get all my experiences and you look it on my CV. Actually, it's not the case, right? Because you can show me how good you are on the CV, but at the end, if this specialty is not a good fit for you, it end up creating more time later on to first really figure out what you like. And secondly, if you want to switch to another specialty, that become more work for everyone and also for the system. So kind of like figure out what you like and take the time to do exposure in different specialties and to really try to get to know yourself. I think being a learner over the years, what I realized is the self-awareness that really drive. You need to be really cautious about what you see, your perception, versus what the reality is, and also questioning about your what's important to you. At the end of the day, is it the interaction with patients are going to drive the satisfaction, or is it the money that you bring home going to drive the satisfaction? What matters? What's the values? So those are really the key things that I wish now I think back that I would put it right up front.
Yeah, not to put the cart before the horse, essentially, to like put yourself first and think critically about like what your future wants for the future are, other than kind of, well, aside from giving in to this pressure that like many med students feel, and like I definitely felt, to decide and then like act and then start thinking. Yeah, it often happens, but yeah, that's really, really great to hear. Really sage advice. Well, yeah, thank you so much, Dr. Cam, for chatting with me. I feel like I really got like a great delve into physiatry just by talking to you. And I really do see why it's kind of like a hidden gem in a way among subspecialties, small but powerful, and affords specialists like you the ability to practice like so many different types of medicine, of a specialty that also can afford to will allow you to prioritize your life as well if that's something that you want to do. So yeah, a very excellent choice, and it sounds like you're very happy with being a physiatrist. So yeah.
Yeah, I'm really fortunate. I have many good mentors over the years. I think that also helped in terms of figuring out what I like to do. So I would say, reach out to find your mentors. Mentors has to, align with you, whatever your interest is. Talk to them, get to know the bits and pieces. That really help to put all the pictures together.
Well, thank you everyone for tuning into this excellent episode with Dr. Cam about physiatry. And if you were a resident listening to this episode, a part of a Royal College affiliated specialty, remember to join as a resident affiliate member because it's free. And yeah, thank you so much for listening, and we'll see you next time.